I wanted to come on today and do part 2 of talking about detoxification and how to support you with detoxification. We talked about why detoxification and how do our bodies naturally detoxify, and what are the initial things you can and should do to support your body to detoxify, so that, say you want to do more of an intense detox or cleanse, you want to get your body ready for that. And really, in the process of getting your body ready for a detox, you're actually creating what I would consider what we probably should be doing every day as kind of like a daily cleanse or detox to some degree. Now, sometimes people say to me, am I going to have to avoid alcohol forever? No, you're not going to have to avoid alcohol forever unless, of course, you want to or need to, or if you're having reactions to it, right? Then, okay, yes. But if you're a person where you're just going to stay away from alcohol and sugar and some of these other things that we could take in to our diet that are more for our body to process, the idea is to give your body a break so you can kind of catch up, let your body focus on processing some other toxins and kind of do a reset. In a lot of ways, it allows you also to really create a new kind of homeostasis for your body, a new normal, so to speak, to kind of do a reset. And sometimes you can just kind of feel like, a lot of times people will say to me, I feel like I need a reset. I feel like I need to take a break and shift things up. And so that's oftentimes a sign that you might be like, okay, I'm ready to change. Either maybe you've just been feeling tired or groggy, or maybe weight gain, or skin rashes, or headaches, or not sleeping well, or anxious. And you're just like, I just feel like, here we are living in these human bodies. But while we're living in these human bodies, we want to feel good if possible. And we start to think, what can I do to feel better on a day-to-day basis in my body? And to realize that our bodies are always responding to stresses in our environment, whether that's a psycho-emotional stress or a toxin as a stress, or foods and everything. So we have, as a human living in a body on Earth, we have certain things that our bodies need in order to feel good and function well. And so detoxification or cleanse can kind of be a reset to allow you to kind of come back to, I almost think of it like a carriage reset on one of an old style typewriter, how to just let your body come back to a new homeostasis. I don't know if you're familiar with that term, homeostasis. Homeostasis is kind of like a balance point, if you will. Our bodies kind of find a balance point and kind of stick to it. And then our bodies work to maintain that balance point. Even if that balance point is off balance, it might be maintaining you in a stuck, I call it stress mode. Our bodies can actually maintain us in survival or stress mode. And so we may want to be shifting it closer to an optimal place where we feel better. And so to do that, yes, sometimes we can make a drastic change to really kind of make a hard reset for our bodies. But what can happen is that could be temporary, because as soon as you finish that hard shift, the body's going to drift back toward what it thinks it's supposed to be. And so my way of thinking about it, and what I've found over the years for myself and for others, is that if we make more of a gradual shift in homeostasis, it's less stressful to our bodies, and it's more likely to create lasting change, which is what our real goal is, right? We don't want temporary change. We want lasting change. So for our health and for our life and for our bodies. So you want to make some shifts gradually over time to shift that homeostasis in a way that doesn't stress your body more, but ends up creating a shift toward a better balance, a balance that actually reflects you feeling good. So, physically, emotionally, mind, body, everything. To me, everything is so interconnected. I don't look at it separately. I look at us as one whole interconnected system. So when I'm speaking about it, a lot of times I just know that I'm speaking about it in terms of our whole interconnected system. We might be thinking physical level, but that's that's going to overlap on an emotional level, spiritual level. Everything's interconnected within us. And so we want to be able to create a shift in all of those levels together and help to realign and shift away from that stress and survival mode that we can end up in, and including from toxin exposure or from either dietary toxins or dietary choices that are more inflammatory. And so that's what we talked about in part 1. And so as you're making these gradual shifts to, say, for example, just, implement more self-care, drinking water through the day, getting electrolytes, making sure you're getting to take deep breaths, to have regular bowel movements, to just get enough sleep even, and some movement or exercise. And we start to get these foundational pieces in place. And again, I think of that as a preparation for a cleanse, but it's also preparation for just being in your daily life. And that's what a lot of what I help focus on in my stress remedy program. We do a lot of blood sugar balancing and leaky gut healing and helping to just get the water intake and the protein intake back to a better balance point in a foundation that then you can work from. You can work from that better foundation. So say you're doing all of that and now you're wanting to add to that. You're wanting to say, you're thinking, hey, can I take some vitamins, some herbs, some antioxidants? What can I do to facilitate the detoxification process? And so I want to dive into that a little bit more today, so you can get a little bit more insight into it. I want to make sure you understand that it's very individualized for each of us. We know that our genetics play a little small percentage of a role, but they do play a role. And our genetics do play a role in detoxification. So let's think about the liver, for example. So in the liver, there's the way we think about it in terms of physiology is there's these 2 phases of detoxification. The first phase, when the toxins come in through our bloodstream into the liver, there's the first phase, which is we think about as these CYP enzymes. And these CYP450 enzymes have a lot of different steps that they can process. But if you just think of an enzyme as a metabolic process that turns one thing into another thing. So these toxins and chemicals and even our hormones like estrogen come into our liver, and the enzymes turn it from one thing into the next thing. And these enzymes require certain nutrients and they have a genetic influence. So if you have genetic variations on CYP enzymes, that's going to influence how do the toxins go through quickly? Do the toxins go through slowly? How quickly do these enzymes metabolize? And that can influence whether you're metabolizing toxins quickly through phase 1 or slowly through phase 1. And so just know that you're an individual. And that's why some people might say, oh, when I drink caffeine, I feel worse, or I can drink a ton of caffeine and I don't feel anything. Or say even with medications, if you might find some people take a medication and they feel side effects right away, and another person can take high doses and they don't feel anything. It has to do with how these processes in the liver are working in each individual. Now, as humans, it works overall, even with these slight variations. But it's helpful to understand that we're not all the same, and even then to be able to accept that. Like if a different person may have a slightly different experience with their environment or something they take than you do. And so just understanding that about ourselves and understanding that there's ways that you can test that to some degree. I always wish that there was some better testing. Hopefully at some point in the future, we would be able to actually show, exactly what's happening in your liver. There's some that give us a somewhat of an idea of CYP and CY2, phase 1 and phase 2 processing in the liver, but it's not as detailed as one might think or that one might hope. So some of it we determine based on your symptoms and how you're feeling. Some of it we might do different testing that gives us a sense of it. Like with estrogen, we can do urine testing that gives us a sense of how well your CYP processes estrogen, for example. So there's tests that could be done, but it's not going to show in the regular blood work. In the blood work, when they test the liver, it's only going to show if your liver's really stressed, I would say. Then you see these liver enzymes, ALT, AST, or maybe GGT, start to increase. And sometimes they're only slightly increased. And you might go, what's going on? It just means your liver's a little overwhelmed and those enzymes are working extra hard, and the numbers will go up in your blood work. If someone has, let's say, hepatitis, those numbers go way up in the thousands. So if it's a little bit up, that doesn't mean that you're, necessarily having severe liver damage if it's just a slight increase, but it does get your awareness of, wow, if it showed up even a little bit on the blood work, that's significant. That means we got to figure out how to help your liver to metabolize better. Because a lot of times I think the liver is working hard and it doesn't even show on the blood work. So just be aware of that. It's not like you probably won't get a pain. You probably won't see it on your blood work. You might just feel it in terms of notice it in your body, on your skin, in your eyes, in your digestion, in your body weight. These are the ways we see toxicity in terms of symptoms. So the other thing that helps would be to do testing for the actual toxin levels, and that's also possible. You can, it's not usually in the standard lab or covered by insurance, so you just have to know it would be likely an out-of-pocket cost. But you can do these specialized tests for urine, let's say environmental toxins. I was looking at one earlier today for a patient because we saw that there's something called 8-OHDG. And 8-OHDG is a metabolite that indicates oxidative stress in the body. And so we can see it in a urine sample, again, from a specialized lab. Usually it's going to be an out-of-pocket cost, but it can show you if 8-OHDG is a little bit high or even a lot high, that tells us there's going to be some toxicity that's causing oxidative stress in your body. And so then we know, let's go figure out why the toxicity, where is it coming from? And so on that patient, I saw her 8-OHDG was at like a 4.5. And I said, we got to look for toxicity because she's trying to get pregnant. And so we went and did an environmental toxin panel. And lo and behold, she was high on at least 6 out of 15 of the environmental toxins. Now, these are things like exhaust fumes from cars and plastics in our environment, pesticides, insecticides, other types of dry cleaning toxins and glues and that kind of thing. And so we could see on her panel that she just did have high toxins on a number of them. And so then when we look at which toxins are elevated, we can also then understand which pathway in the liver needs support in order to process those toxins. And so that's where a toxin panel can be helpful. We can also do a toxin panel for mold toxins, urine panel that'll show us, are there mold toxins coming through your body? I just ran one on myself because I was seeing it so often in patients, mold toxicity. I'm like, oh my gosh, I got to make sure and see if I have any mold toxins. And my mold toxin panel just came back as essentially negative. There was a tiny, tiny little bit of a mold toxin, but it's really so minor that it's unlikely to be an issue. But so I'm so grateful. I'm so glad because I worry because sometimes mold is sneaky. You might not actually see it in your home. It might be behind the walls or hiding in a location that you don't realize, even in your car. And definitely, if you're curious about mold toxicity, listen into the podcast on the discussion that I have, a full conversation about mold toxicity, because it's, so common and so important to address. So even when we're processing mold toxins, we come back to some of these same needs to help with detoxification, the same, making sure you have enough water and fiber and bowel movements and supporting your liver. And so if you know you have mold toxicity, it's going to be a detoxification process that you go through. And we include certain herbs and nutrients and substances that help in particular to move the mold toxins out and help your body recover from mold toxins. So, I'll talk a little bit more about that, but I just wanted to point out you can do a test, a urine test for mold toxins. You can do a urine test for glyphosate if you're wondering about that. You could do urine tests for metals. That's a more specialized urine test. So you would want to work with me or another practitioner who understands how to do appropriate and accurate testing for metals, if that's something you're worried about. But so these are all different tests to give you a sense of like, where are the toxins coming from? And so first of all, we start by thinking, okay, are there symptoms? Maybe we do a test like 8-OHDG or a test like an organic acid test to look at your mitochondria, to look for signs of oxidative stress and toxicity. If we see that, then we start looking for which kind of toxins are there, and we might get clues from your exposures in your environment to know what we should test for. And then we can specifically address them. And as we're addressing them, we're coming back to the liver, and we're saying, okay, how do we help make sure CYP system, the phase 1, is working? And then the second part of liver detoxification is what we call phase 2. And this has several different possible inclusions in the phase 2 of liver detoxification. This is where methylation happens. For example, some of you are familiar with MTHFR and methylation. That's in phase 2 of liver detoxification. And so we want to make sure that I think of methylation as your B vitamins. Let's make sure you have enough of the right B vitamins for your body to do methylation, which is the part where you're metabolizing the whatever toxin or estrogen and methylating it so that it can get out of your body safely and without causing more damage. In phase 2, we also have the glutathione. Some of you may be familiar with glutathione. Glutathione, our bodies make after methylation from homocysteine. It can go down the pathway that creates glutathione. And glutathione is our just super duper antioxidant made in our liver for our body, but we can get depleted in glutathione when our body's working hard to process toxins. We can use it up. Glutathione almost is like on a recycling. So we make it, we use it, and then we recycle it and use it again. And this recycling of glutathione requires other antioxidants like vitamin C. And if you want to make your own glutathione, you need the precursor nutrients, including NAC. So some of you might be familiar with, sometimes people say NAC or N-acetylcysteine. N-acetylcysteine is an amino acid precursor to glutathione. And so you can use the precursor nutrients like NAC, so your body has more available to use for making glutathione. You also want to make sure you have enough vitamin C to recycle your glutathione, or you can actually take glutathione. Now, the thing is that glutathione is one of those things that doesn't get absorbed very well from our digestion. So when you're taking glutathione, you would want to choose what's called a liposomal form. You combine the glutathione with some phosphatidylcholine, which gets absorbed through the digestive tract easier. So you can absorb the glutathione in as active glutathione for your body to use. Or there's also clinics where you can get IV glutathione along with IV vitamin C, for example, if you want to get a big dose of vitamin C and glutathione. Yes, sometimes that's a useful and good thing to do, but I would say even just daily oral doses are good. You just want to make sure you're getting a liposomal form that you can get absorbed into your body. By the way, you can measure, like if we want to get a better sense of how well is your glutathione, like you can measure glutathione in, there's specialized blood tests for glutathione, but you would want to measure reduced glutathione, which is the active form. If you just order regular glutathione, you don't know whether if it's in the ready to go or the used up form. They batch it all together. So you want to know how much glutathione do you have ready to help you. We can also see that in an organic acid urine panel. And so we can get a sense of your glutathione levels and whether you need more of it.
Something a lot of people don't know is that too much stress can actually create an abundance of health problems like high blood pressure, high blood sugar, anxiety, migraines, insomnia, even fertility issues. This is because high stress puts your adrenal glands on overload. They release cortisol and adrenaline, which controls your digestion, hormones, immune system, energy, focus, and even your emotional response. So how can you beat stress when you don't know where to start? That's why we have a free 7-day stress reset program. It's designed to help support weight loss, digestive healing, and hormone balancing. It includes support for integrating self-care, daily tips come to you by email and video, gluten-free, dairy-free meal plans, as well as grocery shopping lists, journal pages, and more. This free program will help you beat stress and put you on the path to wholeness in your body. Get your plan now for free at drdoni.com.
And then you can decide. Sometimes people actually take NAC and glutathione because NAC also has other purposes it serves in our bodies for supporting detoxification and so on. So those are a couple. But you see that there's the main pathways, like there's the B vitamins. So B vitamins are important for detoxification, the glutathione pathway, and even both of those pathways have a lot of cofactor nutrients, we call them, which usually are along the lines of minerals or other nutrients like other B vitamins. So we need zinc. Zinc is a really common cofactor in the liver for these metabolic pathways to happen. So that's why a lot of times you'll see zinc mentioned when we're talking about a detoxification, because a lot of these pathways in the liver require zinc in order to work well. Same with vitamin C, same with magnesium, selenium. And so these are also considered, zinc and selenium and vitamin C are all antioxidants also. And so if you think about it as we're actually doing multiple functions at once. We're being cofactors to pathways and we're being antioxidants. And so some of these nutrients that you can find even in a multivitamin, now it shows you why it's in a multivitamin. Some of these B vitamins, vitamin C, zinc, selenium, our body uses them a lot, and especially in detoxification. And so that's where we put our focus. When we want to add something to your cleanse or detox, we say, hey, let's add the nutrients your body needs in order to detoxify well. And there may be, you might have an increased need for some of these, like based on your body, you might need a little more zinc, or you might need a little more of the B vitamins or less. And that's where doing testing can help. We can do nutrient testing to see what are your zinc levels. Do you need more or less, for example? And so we can really get detailed about this, which can help in some cases. If you know you have a high toxic load and you're going to be going through a process of detoxification, then it can be worth it to do some testing to really fine tune, and we can then really know we're giving your body the doses it needs. Yes, you can do a general dosing, which is okay for some people, most people, but sometimes we need to fine tune it, and that's where further testing and working with a practitioner can help you be more effective. There's other pathways in the phase 2 liver too. There's glucuronidation, something called glucuronidation, which is, can also be supported, safe for example, by calcium D-glucarate, provides support for glucuronidation. And so we want to just go through these process of how do we support these pathways. There's also a sulfur pathway. And so for some people, the sulfur pathway can get stuck, just like the other pathways can get bogged down, right? If we don't have the right cofactors and things are getting overwhelmed. And if the sulfur pathway gets stuck, people tend to be more likely to react to substances that contain sulfur. So if you find that when you say take a sulfur antibiotic, or if you eat foods high in sulfur like garlic and onion, if you flush or you have a headache, even after you eat something high in sulfur, that's an indication that your sulfur system is jammed up, and we need to help get that sulfur metabolism working again. And this is really key because a lot of times people don't realize that, and it doesn't show really on any tests. So we only know it based on your symptoms. When I'm ever working with patients to detoxify and help them with methylation, I like to look at sulfur and make sure the sulfur system's working. We can look at urine strips to measure sulfur levels in the urine. And if we see the sulfur's high in your urine, we're going to go through a specific process of avoiding sulfur exposure for a couple weeks to help clear that system out. And then we can use something called molybdenum, which is another mineral cofactor. Molybdenum helps with the sulfur metabolism. Molybdenum also, by the way, helps with aldehyde metabolism, like aldehyde from alcohol and yeast. So sometimes we use molybdenum to help there too. But molybdenum helps with sulfur metabolism, so it's helps us to clear out the sulfur system. And so again, it's in phase 2 of liver detoxification. There's these different systems, and you can actually go through and look at how and make sure that each of those systems is working well for you and how to support each of them. And then we're really, the toxins go into the bile. And so the thing is once the toxins that have been through phase 1 and phase 2 go into the bile, they're going to go through the gallbladder into your intestines, and that's how it gets to your intestines. Now, if you have a bog down in your gallbladder, in your bile function, that could be an issue. The toxins are not going to be moving through smoothly. So a lot of times when we think about a detoxification, we also are supporting bile production and bile flow. And sometimes I'm trying to think, sometimes if you know you either get gallbladder pain or you had your gallbladder removed, then we know, okay, there's probably an issue there. We need to support it. If you tend toward bacterial overgrowth in your gut, if you tend toward, that's another sign that maybe your gallbladder needs attention. Or if you do a stool test and you see there's undigested fat in your stool, that tells me there's probably an issue with your bile production. And so we want to help with that bile production. Now, one of the main things for making bile is choline. And choline is made by our bodies in the methylation, back to methylation again. The methylation process makes choline. So if we're stuck with methylation, we're not making enough choline, we're not going to have good bile to process our toxins. And so when you see a detoxification formula, say a supplement, a lot of times you'll see choline in there along with some B vitamins and maybe methionine, which also helps with this process. And this is all to help with the bile production and moving the toxins through your liver and out into your digestion. And so you can also potentially use other products that help with bile production. There's one particular that's been very helpful recently called Tutika. We call it Tutika, Tudca, which is the precursor nutrient to, or precursor to making bile. It's essentially you're adding in bile, helping your body make bile. And you can also help your body make bile using herbs. There's a lot of herbs that are what we call cholagogue and choleretic. These are herbs that help our liver to make bile and let the bile move. And so that brings me to talking about herbs that we often use with detoxification. Plants in nature are amazing at helping us. There's plants that help us stimulate our digestion. Usually that would be bitter herbs, like gentian would be a classic bitter herb that stimulates our bile and pancreas to help us digest our food. That's going to be supportive for detoxification. Also, there's herbs we know that are really good at supporting the liver, like milk thistle is a classic herb. And they researched milk thistle quite a lot as a protector of the liver, but also supporting detoxification. It's a very safe herb. So I always like it when there's herbs that you can feel really safe with taking. And say 500 milligrams can do a lot of good. There's also dandelion root. Now, it's important to distinguish that dandelion leaf is a diuretic. So dandelion leaf is doing a different thing. It's having you, lose water through your urine. Dandelion root is more supportive to the liver. There's also artichoke and many others. In fact, you can, if you think about eating leafy greens, like say kale, chard, dandelion leaf, and these are going to be, or even artichoke or beets, root vegetables in general are thought to be liver supportive So when you're doing a cleanse or detox, you might want to choose more of these foods that are going to be more liver supportive in general. And then you could also take either a tincture or capsules that may have additional, say, milk thistle, dandelion root, artichoke, and there's some others too. But those are some really common ones that you'll see that are, again, relatively safe. They don't tend to have, you can get benefit at a low dose, and they don't tend to have toxicity or negative side effects, although it's always important to pay attention to your body and check in with your practitioner before you take anything. So definitely, don't just take what I'm saying. I'm just trying to give you general education about these different options, and then you have to choose what's right for you and what dose is right for you. So let's see. So those are some of the common herbs we might use to support with liver detoxification, whether that's from whatever toxins, from toxins from plastics to toxins from mold. We can use these same plants. And a couple others that come to mind would be green tea and curcumin. Also resveratrol, something called resveratrol, which a lot of times we think of resveratrol as coming from red wine, but we can also get resveratrol from plants like Japanese knotweed. And resveratrol, as well as green tea and curcumin, are very high in bioflavonoid content. I would really think of them as like antioxidants. They're very protective. So they help protect our cells, protect our DNA. They're kind of protectors, if you want to think about it that way. And so it's nice to add those when you're doing detoxification, because they can help your cells be protected from the toxins and be protected from the detox process, and help your body recover from the toxins. And so you'll often see things like green tea, curcumin, whether you take them individually, like you could take a dose of curcumin, which is also very liver supportive. And curcumin is anti-inflammatory, as well as having a lot of bioflavonoids that are protective. And then there's green tea, which you could drink green tea. I would probably do organic green tea, and maybe, or you could take capsules of green tea, and then you could do, or sometimes there's formulas that have these in combination. So this is a way to think about it in terms of when you're putting together what you're going to take, you want to look at the purpose of each and choose from each of those groups, right? So you want to be taking things that are going to support digestion. They're going to support liver detoxification, that are going to support bile, that are going to support your digestion in terms of bowel movements. So you want to choose from each of those categories and match what matches for you. You might do better with capsules or herbal liquids, or maybe you're going to do better using mostly plant form or herbal form. I mean, amazing when you think about some of the herbs we use when we're cooking, like even oregano and thyme and rosemary those are all antimicrobial, antifungal, antibacterial, and they're also going to be supportive of digestion and liver function. So some of these herbs we use all the time are actually helping us all along these detox and cleanse pathways. And so it's a reason to use them usually in your cooking. But also when you're doing a detoxification, you may also want to add an antimicrobial layer to it. And so you'll see this in some detox programs where they'll have you do something antimicrobial, whether it's, some of them are really focused on antiparasitic. So you might see formulas that are using like black walnut and herbs that would potentially kill if there's an overgrowing parasite present. Now, to me, I'd rather test and find out if there's something and then address it specifically. But sometimes people just choose to take herbs for a short-term basis in case there might be something there, because sometimes it is hard to catch these on tests and it might not show. Also, so you might see this where it's like a antiparasitic, antimicrobial, antifungal, antibacterial formula that might also have things like oregano or thyme or berberine, or I'm trying to think of some of the other common ones, garlic, either individually or in combination to be in an antimicrobial. Now we know, like this is very traditional, these uses, But now, because we can test bacteria, we know sometimes there's bacterial or fungal overgrowth in the small intestine and the large intestine. And so we can actually get way more specific about that process of how do we want to be antimicrobial against the organisms that might be overgrowing. And at the same time, we want to support the good guys. We want to make sure we, in the end, are supporting your good bacteria. The good thing is that herbs tend to address overgrowing bacteria without overly causing an issue in the good bacteria. So we can use herbal approaches, especially for a period of time, if there's an overgrowth, and then support the good guys at the end to help make sure you get to more of an optimal balance of bacteria. Because, of course, these bacteria help us with detoxification too. They help us with nutrient production. They help us with protecting our communicating with our immune system. They help us with detoxification. So we want, and if we have the wrong bacteria, they're producing toxins and they're adding to our toxins. So we want to also consider them. I would say if there's an imbalance of bacteria or microbes, I should say, if there's imbalanced microbes in your gut, then that can actually be a source of toxicity. And so we want to be able to address that and get your microbe balance much better balanced. So now you're not getting toxin exposure from your gut, and you're actually getting help from your gut bacteria for all the functions in our body. We know that these bacteria are running the show much more than we ever realized before in terms of immune system, nervous system, hormones, everything. So, and not just the bacteria, but other microbes like helminths. And I help a lot of people with using helminth therapy to help them optimize their microbe environment to benefit their health in different ways. So let's see if there's any other questions you guys have. See if I covered good. If I've got you. Hi there. Thanks for saying hi. Let's see. And let me know if you guys have any questions about this. The thing is that you can do like I would say my stress remedy program is a really good place to start in terms of especially getting yourself ready for, just getting started, right? Getting yourself into that mode of supporting your own detoxification. And then you can add products like maybe an herbal combination for liver, bile support, for glutathione, for example. And you can find those at my website under Dr. Doni's store. And also in the recent blog post, I write about these different toxins we're exposed to, how to help your body to start working on detoxing, including with some of these supplements and nutrients and herbal approaches to help your body to detoxify. And so you can design your own detox, or if you have a sense that this might be a more serious issue, then I definitely encourage you to dig deeper and invest in finding out which toxins need to be addressed and really making sure you effectively get them out. Because otherwise years can go by and you're still wondering, hey, do I still have that toxin in my system? Because these toxins can last a long time in our bodies. Environmental toxins, mold toxins, metals, they just can sit there in the tissue. And so if we're not actively supporting our body to detoxify, especially if you have a block in any of these systems, that we've been talking about, then the toxins just keep recirculating, and you start to see heart disease, diabetes, dementia, and so on, cancer. And so we want to help your body to detoxify, but we want to do it safely. We don't want to cause more stress to your system in the process. And that's why I feel so strongly like yes, you could do it on your own, but if you ever feel worse, or you feel like you get stuck in the process, then you definitely need a practitioner to help you. And you may want a practitioner to help you from the very beginning, because if you're going to invest in detox and putting yourself through all of that, better to have some guidance from someone who's helped a lot of other people and who can guide you how to be most efficient and effective at doing it. So I think we got it. And I hope that helps. Be sure to check the other podcasts on this topic, check the blogs on this topic, and reach out to me if you have questions, because it really, I know it's something that comes up for a lot of people. You're trying to figure out how to detoxify effectively. And I want to be able to give you those answers so you can be successful at it. And let me see, I'm going to also be doing my own detoxification a little more in depth over the next couple of weeks. So I'll be back to share with you what I learned through that process. All right. Take care. Talk to you soon.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdoni.com.